The hamstring is the most frequently strained group of muscles in the body. You can see from this chart that you've got the biceps femoris that is creating that knee flexion with an external tibial rotation, whereas the semitendinosus and semimembranosus are going to be part of that internal tibial rotation. And so those muscles are actually fighting in opposite directions, thereby increasing the risk of a strain. During the gait cycle, we have two main phases to look at. During the swing phase, your hamstrings function eccentrically to help decelerate the leg. During the stance phase, the hamstrings assist in extending the hip and adding stability of the knee. So there's a lot going on with the hamstrings when a person is ambulating. Additionally, these two periods result in the highest forces on the hamstrings, so you're going to have obviously an increased risk there as well. The mechanism of injury for a hamstring strain includes a rapid contraction during ballistic action. There may be a violent stretch. There may be predisposing factors. Your hamstring is made up of more type 2 muscle fibers, which tend to generate high force levels. Your hamstrings are biarticular muscles, which we already know are going to be at increased risk for strains. They will act in a deceleration function coupled with sprinting ballistic movements that can cause fast-moving limb with high forces within the muscle. Other predisposing factors include fatigue, which when that happens, those muscles are less able to absorb force. There may be a prior injury. There may be neuromuscular components that contribute to the strain itself. 80% of all of your hamstring strains are going to involve the biceps femoris. I can remember when I was an athletic training student and working in Holt Arena, and we were working track one day, and as I'm talking to one of the athletes, we heard a sound that we literally thought was a gunshot going off in Holt Arena. Somebody called us over to the other side of the arena, and one of the sprinters was laying on the ground grabbing the back of his leg, and his hamstring had ruptured, and that gunshot was the sound of his hamstring ruptured. So it can be a very violent injury. Signs and symptoms then include edema, ecchymosis. There can be localized pain that is at the myotendon junction or the tendon attachment itself. The person may complain of pain during the terminal swing phase as well as the heel contact phase. Range of motion is going to be decreased active and passive range of motion for knee extension as well as hip flexion. Manual muscle testing, we're going to want to test both the medial and lateral hamstrings. We will do this by internally rotating the tibia for the semimembranosus and semitendinosus, and externally rotating the tibia for the biceps femoris. Diagnosis is going to be clinical, although an MRI may be used to determine how extensive the muscle has been damaged, and treatment will be conservative. Again, conservative treatment is not necessarily the fastest way of doing things. There has been research that intramuscular corticosteroid injections in professional football players within 72 hours of injury resulted in significant reduction in time to recovery. However, growth factors, gene therapy, stem cell research is also being done on hamstring ruptures. If we look at the pathophysiology of muscle strains, again, reviewing, we have three phases. We have our acute phase, which is characterized by rupture and ensuing necrosis of the myofibers, the formation of a hematoma, and the inflammatory cell reaction. During the proliferation phase, we have phagocytosis of the necrotized tissue, a regeneration of myofibers, and the concomitant production of connective tissue scar, as well as capillary ingrowth into the injured areas. Finally, during that maturation phase, we have maturation of the regenerated myofibers, the contraction and reorganization of scar tissue, and the recovery of the functional capacity of the muscle. Unfortunately, when muscle is healing, it doesn't heal as bone does. And in many cases, it may only heal to about 50% of the strength that it was prior to being damaged.